There's no doubt certain groups of people need more immediate access to health care than others. Among them are veterans.
Certainly so. Now, we've received calls about long wait times or appointments being canceled without notice, something that this group says is a roadblock to them getting adequate health care.
Yeah, in this 3 News series, Waiting Room Waitlist, our Josh Maxwell takes a look at why veterans are having a hard time being seen at the VA.
Many of our veterans come through Naval Air Stations Corpus Christi and Kingsville to train before deployment. Coming home, they expect access to adequate health care. But there are many who tell us that's not what they're getting.
How difficult it is making their appointments and getting in, and it's kind of discouraging.
Gil and Sandra Olivares are one of many couples who are familiar with the Corpus Christi VA clinic and how challenging it can be to get in with a doctor.
And that's the reason that we're still seeing doctors out of town instead of going to the VA.
Among others,
they're not accepting new patients. Right. And the other thing is that they're booked until 2025, like 6 months in.
Providers are pretty busy. They have a full panel of patients.
Hugo Martinez is the public affairs officer for the Texas Valley Coastal Bend healthcare system. He says that while it's unfortunate, there are instances where appointments can get canceled. And when that happens,
for continuity of care, we would like for patients to be seen by their own provider, so they're placed on the next available appointment, sometimes 3 to 6 months out.
The VA has 17 health providers who can see anywhere from 6 to 14 patients a day, though some general practice physicians I've spoke see far more than that in one day.
My first day in practice as a physician here in Corpus Christi, I saw 25 patients.
Martinez says that for patients who need to be seen sooner rather than later, there are options for them to consider.
But we have what we call gap teams or gap providers. So the patient will not see their own provider, but nevertheless, they'll still have the opportunity to be seen by a primary care provider.
Martinez says that for those whose appointments do get canceled, there are measures to make sure you're kept in the loop.
Our staff does make 3 phone attempts to contact the patient, and if not able to do so, they'll send emails, they'll send secure messages, and they'll send letters as well.
But as for Gil and Sandra, when it comes to finding a doctor, there are certain standards that come to mind.
Accomplished doctors and have a good history, a good resume. That's what I'm really looking for whenever I'm looking for a doctor here, so that I don't have to go so far.